The arrival of spring means yard work, getting the kids ready for spring sports, and so much more. But is your back ready for it all? Joining us now from non-surgical orthopedics to make sure you remain injury-free is CEO Dr. Arnold Weil. Thank you for being here, Doctor.
Oh, thanks for having me.
Appreciate your time. So who are the doctors of non-surgical orthopedics?
Well, we have 4 physicians, myself, Dr. Anthony Grasso, Nicole Forsyth, and Yolanda Scott.
Well, talk to me about what the difference is between your office and other orthopedic offices out there.
Well, we really specialize in non-surgical orthopedics. So, our goal is really not just to treat symptoms, but to really, find out what's causing the pain and treat that. And I think, that's what we've really established over 20 plus years. And, I think one thing that makes us really stand out is, we try to get patients in, new patients within 24 hours.
That's excellent.
We believe if you have pain, you shouldn't have to wait 3 weeks, 2 weeks, or even 1 week to be seen.
That is so true. There's nothing worse than that. You have something that ails you and you call and they say, yeah, well, we'll catch you in a few weeks. You're thinking, well, what happens in the meantime? So that looks terrific. And we have all the other reasons there. A small group that gives individualized attention and care to every patient. I know a lot of people immediately with all the changes in healthcare think, though, what about insurance? Do you accept insurances?
Well, we do. We take all insurance. We take Medicare. We take workers' comp, auto insurances. And even, one part of our practice that makes us unique is we have a clinical research department. We do a lot of clinical trials for back pain, joint pain, other types of injuries. So patients that maybe couldn't even see a physician in the past, they can participate in some of these clinical trials, and then they end up getting their care for free.
How wonderful. Yeah. And how about making an appointment? Is it as easy as picking up the phone, calling the number?
Easy as picking up the phone, calling the number, or even going online and contacting us online.
Online as well. Excellent. Now let's talk about the symptoms and disorders that you actually treat in the office. Break it down for us.
Well, we treat a lot of things, back pain being so common. So
right.
Of course, we see a lot of back and neck pain. Patients that I got asked before I came in here if you could have back pain or hurt your back sleeping on a mattress for one night, maybe a bad mattress. And that was a great example of the type of patients that we see.
Really?
Patients that develop pain, they don't know what they did, or maybe they injured themselves over the weekend. So we see a lot of patients with back pain, leg pain. We see all sorts of orthopedic injuries, shoulder injuries, knee injuries. So we treat everything.
Sports injuries, yeah, fibromyalgia, acute and chronic injuries. And how are you different, though, when in terms of that pain management, the practices that you play out in your office? Talk a little more about that.
Right. So we really focus on both acute and chronic pain. But how we're different is, again, we don't just use medications. We may use therapy, physical therapy, or different types of injections depending upon the problem. So if someone with back pain that has chronic back pain for a long period of time, we might do spine injections, epidural injections, PRP or platelet-rich plasma injections, which really uses the body's own stem cells to help regenerate that tissue. So we do a lot of things in the office, a lot of injection procedures in the office,
good,
and a lot of procedures in an ambulatory surgical center that's attached to our building. Again,
really?
To really focus on more serious spinal conditions, because most people think that if they have back pain, they're going to require surgery. So we really do things that can prevent surgery in most cases and allow patients to really heal and recover and kind of get back to their normal activities.
Fantastic. So the injectables can be at the office and a surgery center that's connected.
Exactly.
That's wonderful, all in one spot.
Yes.
And talk about, you mentioned the PRP procedure. Kind of go into a little more specifics about that.
Sure. Some of the newer things that really are newer in the U.S. but have been present in Europe for many, many years are prolotherapy and PRP. And we've been doing that for quite some time. And again, instead of injecting maybe a steroid into a tissue or a ligament or an area that's injured, we utilize the body's own platelets or stem cells. So we will take the blood and spin it down and then collect that platelet-rich plasma, which has the stem cells. We inject that back into the ligament or the damaged tissue, and it really kind of causes regeneration and healing of those structures to really strengthen that area and decrease the pain and really promote inflammation so it heals.
Hearing a lot about stem cells, I feel like, in terms of even, skin care and all these different ways that doctors are utilizing it in their practices.
Right. We don't do skincare.
But no, I'm saying, but that's what we've been talking. I feel like other doctors have come on the show saying this is the new wave in technology is, tapping into your own body.
Right, it really is, and it's so effective. So we have a lot of patients that come in that are really excited that, we're one of very few people in the area that even does PRP. So we're really offering a great service to patients.
And how about personal injury, workman's compensation cases, that as well?
Yes, we do that as well. We work with patients who may have been injured in a car accident or some other type of work-related injury. So we take care of those patients. We can work with attorneys. We get a lot of referrals from local chiropractors of patients who've been in accidents as well.
Good. And where can we find you on the web?
Lowbackpain.com is our website.
Excellent. Lowbackpain.com. And what areas of Atlanta do you serve?
Our main office is in Marietta. We have offices in Canton and Carrollton as well.
Fantastic. And what kind of treatments can you offer patients who unfortunately maybe can't afford your services? Can you help out in that realm?
Well, again, we have our clinical research department, which offers a lot of trials for a lot of different conditions. And then again, we have some programs we participate in that allow patients to, again, get their care and work in a financing way.
Right. I guess when all else fails, just pick up the phone and call, and that way at least they can learn more about
Absolutely.
the situation, or you can.
Yes.
So thank you so much. It's a pleasure having you on, Dr. Weil. Thanks for your time.
Thank you.
And if you would like more information about non-surgical orthopedics, please give them a call, 770-421-1420. That's 421-1420, or log on to lowbackpain.com. And this segment was paid for by Non-Surgical Orthopedics.